Hello, Operate Intelligently listeners. This is Joshua Peach, your host, and this morning I am excited to be talking all things H2O with a new friend, Erica Walker from 120 Water. Hi, Erica. Welcome to the podcast.
Hi, Joshua. Thanks for having me.
Well, happy to have you. This is an interesting one. I had Linda, who works with you guys, reach out to me last week and say you need to have Erica on the podcast. Because there's a lot going on in the water world with these buildings that are unoccupied or low occupied that people need to be aware of and make sure that we're doing what we're supposed to do. So let's start out. Who are you? What do you do? And talk a little bit about what you do with relation to water, and then we'll dig into kind of the COVID situation.
Yeah. And yeah, thanks for having me. And actually, the only regret I have is that you can't be in person. I think I listened to your first COVID episode, and you got some people together in cars, I think.
Yeah, we were at a Target parking lot. Yeah, that was a good one. The sound wasn't perfect because we were using just cell coverage. We couldn't pick up the Wi-Fi at Target, but yeah, that was the initial social distancing with Dr. Marcus and Kenny Wirtz. Yeah, that was a good one.
Yeah, and it's a good, you really have something there. I don't know if you've seen or listened to Jerry Seinfeld's riding in cars with comedians drinking coffee.
Yeah, I haven't gotten into it yet. You're like the second person in the last week that told me I need to watch it, so I need to get on that.
Well, what I'm saying is it could be, talking in cars with operations professionals during COVID.
In Target parking lots. Got to give Target a plug. I mean, they're doing great work. All those guys and girls over there putting in the hours.
Yes, but anyway, I digress. Thanks for having me. Yes, I'm the Director of Environmental Policy and Programs, the official water nerd, or one of many. I'm in good company at 120 Water. And I'll talk about that in a minute. So my background, I'm from a rural farming community, grew up around nature, river in my backyard, hiking all the time with my parents. And so I'd always loved that and science courses. I ended up sort of, after taking a winding path post high school, playing a little music with my friends and touring around a bit, I then sat down and thought about what I wanted to do, and remembered how much I loved sort of science and nature, and ended up studying environmental science and policy at IU Bloomington, which is where I live. I'm in South Central Indiana now. And in my career, I've been mostly in the public space. So I've worked for water utilities on drinking water protection, public agencies, the EPA for a short stint in college, and the Indiana Finance Authority, which is sort of like an environmental bank for drinking and wastewater plants. They fund all the infrastructure improvements that states do around the country. And actually, like so many people in the drinking water space, after Flint happened, I sort of got pulled into lead. And at that time, the agency was offering free water testing to all public schools in the state of Indiana for lead. And so I helped run that program. And my particular role actually was when the data would come in, I would review it, and I would get on the phone with facility managers at public school districts, and we would talk about what the results meant, and really practically what can they do in the short term to protect public health, how can they get lead out of their facilities. And as I was sort of looking at what would be next, 120 Water, the company that I work for now, they built a software platform that the state used to operate that big project and program. And I still really care about the issue of water quality, lead, and other issues like PFAS and Legionella. And so I felt like I could make a big impact at this company. And we are a software company, a cloud-based software company. We run out of Zionsville, Indiana. We're in 15 states today, and what we're really trying to do is we're helping people who are monitoring water quality in their buildings, in their cities, and in their states, manage that data, collaborate with one another, coordinate between lab entities, and then do something with those results. For instance, and we'll probably talk about this, but facility professionals, especially operations staff, have a million things to do. And when it comes to things like lead testing or PFAS testing, this is a project. They're constantly putting out fires, they're constantly doing other things. And so being able to take those results and make it actionable, being able to communicate it back, we feel that that's really just as important as doing the testing work itself. And so, our products are all sort of about managing that entire process.
Mm-hmm. Interesting. And I think I told you when we did the exploratory call, I was in the spring water business, spring water delivery business.
Right.
And the big buzz back in the mid 90s, early 2000s was cryptosporidium in water, which is the bacteria that you don't hear about too often anymore, because I think the filtering and the chlorine or whatever you put in whatever's put in the water is getting rid of it. But the lead and the PFAS stuff is definitely very scary, and it's eye-opening when things like Flint happen. That's just so widespread and such an impact. That's during normal business hours that this stuff is happening. The interest for me with you was because I didn't even think about this. The last 7 weeks, COVID has gotten me to think about a million different moving pieces or non-moving pieces in these buildings that we've never had to think about. And one of the things that I didn't think about is water isn't flowing. So the pipes aren't, there isn't a lot of activity in those. There's not toilets being flushed. There's not sinks being run. There's not water fountains being filled, with bottles. And I didn't think that there was much of a risk to it other than water is just sitting and it might come out a little brown or discolored over time, which I think that's a natural thing that happens. Correct me if I'm wrong, but there's risks involved, and there's things specifically that our facility professionals should be thinking about when they have a building that we're going on month 2 of unoccupied. And realistically, now we're going into the summer. They're going to be going, essentially March 16th to at least August 31st before there's any real occupancy of any level of regular use. What are some of the risks, or what are some of the things that they should be doing to prevent any of those risks from becoming something?
Yeah, let's talk about the risks first, and then maybe some of the steps that people can take. You mentioned sort of, I like your way of framing it, that we almost have kind of an extended summer period of dormancy in a lot of these buildings, especially when we think about schools. But really, the 2 primary concerns we have are around kind of the loss of disinfection effectiveness or power, and then the corrosion of metals. You mentioned cryptosporidium. In our long history in the United States, we've really focused on disinfecting water. That's been the biggest emphasis in water treatment. And we've come kind of a long way since the era of the common cup, right? When we would actually literally all be sharing the same cup on a train or at a public well. And we were transmitting diseases between each other. We then realized that, within the actual drinking water itself, things like cryptosporidium can be transferred. And so we started disinfecting water. In buildings, it's kind of this next level thing. If you are receiving water from a water utility, for example, that water utility has taken steps to disinfect with chlorine or UV or other things. And that disinfectant can lose effectiveness over time as it's interacting with organic matter in the water. So as that disinfectant residual decreases, then what you start to worry about are pathogens and bacterial growth happening inside of the actual pipes in the biofilms. So, you're worried about things like, have you heard about Legionella?
Yeah.
Okay, right. So Legionella, that's probably one of the more well-known, at least, at this time, risk factors for really any large building. We can be talking about schools or hotels or other things. And And so certainly as that disinfectant residual goes down, it can promote the growth of those things. So that's one sort of disinfectant risk. The other thing though is that at the same time, as that disinfectant is interacting with the water, it can produce what's called disinfectant byproduct, and that can build up in the water. And as that interaction happens, as that stagnant water is sitting there and the disinfectant byproduct is building up, that really just increases risk, right? For when someone goes in and takes a drink of water, they might be exposed to what is a possible human carcinogen. So that's disinfection. On the corrosion side, we're really talking about water stagnation increasing the corrosivity of water and pulling out heavy metals from the plumbing infrastructure itself. So that's what a school or another large building would own. We're talking about things like solder, possibly lead pipes. So you know, those are the two big risks. And in terms of what facilities can do, you know, number of steps they can take. The first I would say would be to develop a flushing plan. And there are a number of great templates out there. I think the first I would point folks to is a center called the Purdue Center for Plumbing Safety. They've got a few templates out there that actually say, you know, if you have this type of infrastructure, the size of a building, you know, this is how you would set your team up to do flushing. That notion of pulling fresh water in, trying to flush the entire volume of the water in the building, and pull maybe some of that lead material that has come into solution and that is sitting in the pipes out of the building, and at the same time bring fresh chlorinated water back into the system, right? Okay. So even before people come back into the building, I think flushing, if done correctly, and this is, you know, this isn't as simple as just like turning on the tap for a couple seconds, right? You actually have to have a plan in place and make sure you're moving the entire volume of that water. But doing that can actually decrease the likelihood that you'll have a loss of disinfection power and that you'll have a bunch of corroded metals sitting in the water.
Okay. And just out of curiosity, you know, the stupid question, you know, pipes were made out of lead up until when? Like how, like what, are they still made with lead? Is there still, like, is that the most prevalent use? And, you know, what's the, you know, cause I think about, you know, there was a water main break and most people don't even think about that, but that's basically the breakdown of the metal pipe that carries the water, whether it's sewer or tap water, and that there's something wrong. What is that? What do people, what is in a typical municipal? Does every town USA have lead pipes?
Right. It's actually a really interesting question, not stupid or silly at all. It's one of the most important questions that we can ask about this issue. So, you know, it's the 6-year anniversary of Flint, Michigan, the water crisis there, I think last week actually. Wow. And yeah, and there, of course, you know, what we were talking about were lead, they're called lead service lines. And you brought up Maine. So a service line is basically the straw that connects a municipality's main to a person's house. It's the delivery pipe for drinking water in a residential home. And we used to make those out of lead, as you said. Actually, about 200 years ago, most cities started putting them in the ground, and we didn't stop until the EPA made us stop in 1988. Now, some cities stopped a lot earlier. Maybe they had plumbing codes that prevented them from doing it, and some cities even passed laws. But like the city of Chicago, for example, they actually required that lead pipes be used for service lines until 1986. So it's not a Flint problem. The issue of lead pipes is a problem in probably every large American city across the nation. The nuance, I think, for facilities is lead is a soft metal. It wasn't cheap. That's not why people picked it. It actually doesn't it doesn't break down as easily as some of the other pipes. And so, you had mentioned the main break. It was actually selected because it's nice, soft, malleable, and it's not as likely to leak. It's easy to move it around and hook it up to mains as the infrastructure changed. So that's what made lead pipes a preferable thing for especially small residential homes. In larger buildings, it is not a good, soft metals are not a good option for transferring water from the main to the building. And so we think they're pretty uncommon in things like schools, maybe residential daycares, unfortunately, but not schools. Where the lead is coming from in school facilities is largely inside the building. And you had asked, is lead still permitted in plumbing materials? And the answer is actually, yes, it is. The definition of lead-free today is 0.25% of the wetted surface can still be lead. And up until 2014, it was actually 8% was allowable. And that company could still call it lead-free. So what that really means is we think that if your facility is older than 2014, you likely have some leaded plumbing materials in your facility. And whether or not you will find that, whether or not the lead will come out into drinking water that you're providing to people depends on the water quality, which is how we bring back in that COVID piece, right? Maybe the water that you were purchasing from your utility, it was treated and it wasn't corrosive. But the moment that the water chemistry changes, like it did in Flint when they switched water sources, then lead starts to come out in drinking water. So it's sort of, it can be in the street in lead service lines, it can be in the facility, and whether or not it comes out is a real unknown and dependent upon the water chemistry in that particular building.
Okay. One of the things that was, as you were talking, I'm kind of thinking through, and today, for whatever reason, in a number of areas in the country, I think that May the 4th was supposed to be kind of a reopen day originally. It was in Massachusetts where I am, but They're pushing back, they're pushing back the idea of reopening the economy and businesses and figuring out what's essential, non-essential, new listing. They've pushed it back to, I think, May 18th. But I know that today there's a number of states and a number of areas that are going back to having their staff in the buildings to do those long time summer projects and things. Let's do this. Let's talk about the 2 or 3 takeaways for our listeners to think about. What should they be doing right now? And then after that, I want to follow it with the 2 or 3 things that they should be doing ongoing post-COVID to make sure that they're providing the best quality product water for their consumers, customers, the students, what have you.
Yeah, so I think right now, certainly look into a flushing plan if you don't already have one. And that flushing really can start right now to sort of prevent your water quality from deteriorating before the doors open, and then certainly carry it on. I would say at least once a week be flushing, even after people come back in the building. So a flushing plan would be really important. I think next would be, if you don't already have one, they're called water management plans. And that's all about really the management of bacterial and pathogen growth. They're specifically for Legionella, but again, there's free templates out there through the CDC and others. And it involves mapping an inventory of your building and monitoring for things like chlorine and temperature. But get that water management plan and your flushing plan in place now. And then the next thing I would say too is while you're mapping, an inventory of your water infrastructure for your water management plan, do the same thing for metals testing if you haven't already done it. I think there's 15 states that require it for schools now, but not everyone does. So go ahead and get that ready, because if you haven't done baseline testing, you're going to want to do that.
Okay. Just out of curiosity, when we open this up, we talk about the facility professionals having a million things on their plate, and the assumption is that they've got full handle on all of them, and everybody's aware of it, and they're widely aware of everything. What do you think the percentage of people that you have an initial interaction with have a water management plan in place? Do they have one? Is it something that was developed 10 years ago and hasn't been readjusted, or has the Flint awareness really driven more people to do more?
Yeah, I think water management plans as a thing in the water industry are specifically about Legionella, and I think
Mm-hmm.
we actually need to bust
Mm-hmm.
that way of thinking apart and say it's about water management in a building, and that includes things like metals and Legionella and PFAS and everything, because we're dealing with really busy folks that don't have time to have these piecemeal projects thrown onto their plate. So I would say, you know, for a water management plan, if we're talking about Legionella, I think there's definitely a lack of awareness there. They're required in a lot of healthcare facilities that provide water to either immunocompromised individuals or the elderly, because those people are most at risk to contract Legionella.
Mm-hmm.
Whereas lead, it's not good for anybody. It's not like iron or zinc, right? We need
Mm-hmm.
those things. They're good for our health. Lead, no amount of lead is good for you or I, but we know it's really, really bad for
Mm-hmm.
children. And so there is a lot of awareness after Flint, not really about Legionella as much in schools, for example, but certainly about lead. You know, like I said, there are 15 states that already require it. So in all of those states, if you're a school in that state, you've heard about lead testing, you've probably already done it.
Mm-hmm.
But I think Legionella is maybe going to be, along with PFAS, that's probably going to be sort of the next wave of testing concern.
Do you want to touch on PFAS a little bit, just because it, like, as I shared with you, you know, my area where I am, PFAS is front and center. It's something that's in our water, our public drinking supply.
Right.
And it's in a number of other places in the country. And I've had a couple of discussions with folks around the country that I know that it's there. And it's not a topic of discussion yet. And, you know, the importance that it should be is I think pretty, you know, getting ahead of it if you can, because there's a number of challenges with it, with filters, you know, filtration, and the different ways to remove it are not necessarily in line with the filtration systems that are in some areas. So you mind educating a little bit on that? I know it's going outside of COVID, but it's not outside of your expertise, so might as well take advantage of it while you're here.
Talk about all the things. Yeah.
Yeah.
Yeah, certainly. We're still learning so much about PFAS, and like lead, every state is sort of handling it in their own way and on their own as we await for a federal strategy.
Mm-hmm.
You know, I think our first emphasis really needs to be on certainly restricting the use of those things. I mean, those chemicals are still coming on the market, actually. There's 3,000 of them known
Mm-hmm.
today, and they're still being produced. So that's happening. I mean, I think where we're at for facilities and for water quality is they're now receiving water that may contain it. And so then, like you said, when it comes to treatment, what do we do?
Mm-hmm.
I think it certainly needs to start with testing. And I would say, just very practically, if you are a facility and you're near a military base, if you're served by groundwater, for example, definitely you should think about testing. You should reach out and see if testing's being done in your area. But just in general, we need to start getting some really good baseline testing across the country. And in terms of the treatment, certainly there's been a lot of good work being done about effective strategies for reducing PFAS, and those things are known. I think
Mm-hmm.
what's not known is how widespread the contamination is in drinking water systems across the country.
And it's known as the forever chemical, forever. Yeah. Because once it's in you, it doesn't go away. And you can have so much of it. I'm still reading up and learning myself about it, but it's potentially very bad for you. Bottom line.
Yeah. It's
So
everywhere. I've also heard it called the devil's piss.
wow, that's a
Right. gross and powerful, but it makes the
Yeah.
point, which is that once you start accumulating it, it's hard to get rid of.
Yeah. Yep. That's the when they said that once it comes into your system, it just stays and builds up. I said I don't want any. So yeah, I'm
Smart.
getting the test in the special filtration system. I've got well water and it's always tested well, but I haven't done it in a while. And but I'm definitely gonna check it out for my home very soon. It's scary to think about all of this stuff when it wasn't very long ago that you didn't even hesitate to turn a sink on in any town USA and just draw water out and drink it. And now there's, a whole bunch of stuff out there that's just not good for us. That's right coming out of that same tap. So we definitely have to be more aware and try to make sure other people are. So
Yeah.
Wrapping up, any closing thoughts, ideas, anything that we missed? And then if there isn't, how do people get a hold of you, and what do you do as far as, coming out to a school? You provide them with the test kits and programming to make sure they work through that. Give a little understanding of that.
Yeah. Well, closing thoughts, take care of yourselves. Anyone listening, you and your families and your mental health and your staff, that's the most important thing. And then, second, I hope that you've learned a little bit about water quality and some steps that you can take now. And when the buildings is opened up, please check out some of those resources that I mentioned on Flushing. In terms of getting a hold of us, we got a website, 120 Water Audit. Definitely reach out to me if you have any questions, Erica at 120wateraudit.com. But yeah, what we provide is a software tool to manage water quality in facilities, and attached with that, we also can provide water testing kits for things like lead. So, if any of your listeners are interested in doing that work, then we might be a company that you want to check out.
Very good. And you're on LinkedIn. They can follow you there or connect with you and check out your activity, because I did see that you have some posts on there about COVID and water management and water testing. So that's a good spot. I'm a big advocate of LinkedIn. There's a lot of great content out there. So
yeah,
listen, this was great. Again, you piqued my interest when we were talking initially, and I just said, wow, I didn't even think about the damage or the challenge with unoccupied buildings to the drinking water system supply. And this was definitely eye-opening for me. I'm sure it's going to be eye-opening for a number of others. And like you said, the idea behind this is to put those million moving pieces or non-moving pieces that our facility professionals have to take care of and places front and center to make sure that they have all the needed information to make best possible decisions and plans to get these buildings back open and occupied as safely, securely, and as healthy as humanly possible. So really appreciate you taking the time here on this Monday morning. Look forward to following along with you, and we'll stay in touch and make sure that we keep helping our folks take care of others.
That's right. Thanks, Joshua.
Thank you. And that will do it for another episode of the Operate Intelligently podcast. We're going to keep pushing the envelope with finding best practices related to COVID that tie into what could potentially be our new normal, and really try to help you guys. If there's any topics that you'd like to hear more about, or have me find a professional that can provide that, I'm more than happy to do that. We're actively working with a number of other exciting speakers and professionals in the industry to help in any way possible to navigate this. We call it unprecedented time, and it is, but it's also a time that we don't have policy and procedure and process in place. This is all new for all of us. So let's do it all together, and look forward to talking to you next week. Bye-bye.